Okay, I think we can get started. Good morning, everyone, and welcome to this webinar focused on sharing insights from Ilifa Labantwana's ECD COVID-19 response project. My name is Nicole Biondi, and I have the honor today of guiding you through this wonderfully information-rich 60-minute session. You'll be hearing this morning from Ilifa CEO Zahira Muhammad on why the project was launched and what they aim to achieve. Zahira will be followed by David Harrison, the CEO of the Douglas Murray Trust, who will share his views on the importance of this initiative and how it fits into the bigger picture. Ilifa team members Andrew, Tembi, and Laura will then share details on what exactly was done, what was learned, and very importantly, what they recommend could happen, and in fact, should happen next to really enable growth and to support a thriving early childhood development sector in South Africa. Now we'll hopefully, and I'll try my best to manage time, so we'll hopefully have about 10 minutes towards the end for some Q&A, but I'd like to encourage you throughout the session, please do pop your questions and your comments into the chat and your questions into the Q&A box. If you get mixed up, don't worry, just keep popping them wherever you'd like, either Q&A or in comments, and we'll do our best to respond throughout. Now, the presentation, as well as more detailed insight briefs, will be shared with you, all of you attendees, after the session, so don't worry too much about taking notes. Now, to get started, we'd like to zoom in and give you a real sense of what this ambitious project undertaken during a global crisis was all about.
Science tells us the first 1,000 days of life lay the foundations for learning and well-being for the rest of life. Safeguarding children's development over this period should be of utmost importance. And yet, in South Africa, of the 6 million children under 5, less than 1 million are in registered ECD programs. Another 2.5 million are in unregistered ECD programs, with around 50,000 sites managing without state subsidies and monitoring, despite the crucial role they play. This was before the pandemic reached our shores. When it did, in early 2020, the sector nearly collapsed. Costly COVID-19 compliance requirements made it almost impossible for cash-strapped programs that served the poorest communities to reopen. And when the government first rolled out emergency support, unregistered ECD sites were least likely to access government support. Children are facing acute food insecurity. ECD programs are closing down, with thousands of staff losing their jobs and incomes. With this in mind, Ilifa Labantwana mobilized resources and partnerships, secured 36 million rand in funding, and teamed up with 3 NGO partners to initiate an ambitious ECD COVID-19 response project. The project had a dual purpose. First, address the humanitarian issues by getting ECD programs open safely, supporting staff and feeding children. And secondly, to use the project to tackle broader systemic issues within the sector.
There are a lot of barriers that prevent unregistered ECD sites from accessing support. So we really wanted to show that unregistered sites can comply with regulations if they're supported.
The really high rates of stunting in South Africa are extremely concerning. We're at 27% of children under 5 that suffer from stunting. And so ECD sites, we really feel that they should be a place where children are able to access nutritious meals, and the government should be supporting them to do that.
In a few short months, we achieved more than we thought possible, providing income support to 3,473 ECD staff and food support to more than 30,000 children. Support packs helped sites to reopen in line with health and safety regulations. By March 2021, almost all of the sites had reopened in compliance with government protocols. A major pillar of the project was the provision of digital food vouchers sent by SMS to participating ECD programs. The vouchers could be redeemed in local spaza shops to buy nutritious food for the children in the programs. Here, we wanted to test how ECD sites can become nutrition hubs with new local food supply chains created in the process.
Into ebalulekileyo uba abantwana masibatyise esikolweni siye siqonde uba ngamanye amaxesha bamka ezindlini.
Ivoucher indisebenzele kakhulu apha ikrishi cause bendibethakala kwithuba lokutya. Ivoucher yandisebenzela kakhulu.
The lessons we learned provide evidence for 3 recommendations that we believe, if implemented, will make a positive systemic impact on the whole ECD sector. Registered or not, ECD sites take care of hundreds of thousands of young children, and so should be supported by the state to deliver nutritional support to them. This way, we can address problems like stunting, malnutrition, and obesity. The voucher system showed there are different ways of getting funding to ECD sites that can be user-friendly and relevant. By designing processes that give us accurate beneficiary details, we can ensure the right people access payments and funds are used properly. Local ECD NGOs can play a critical intermediary role to help the state reach unregistered ECD sites with a range of support measures, while helping to maintain accurate and up-to-date data on these crucial areas. While the impacts of the COVID crisis have been devastating, it has shown that reaching unregistered ECD sites is both critical and possible. Let's invest in our collective future by working together to secure an equal start for all children in South Africa.
Umsebenzi endiwenzayo apha ubaluleke ekuhlaleni nasebantwaneni, kubazali, kwi-community nje seyiphelele.
Obviously, NGOs have played a major role in supporting unregistered ECD sites, but I think my hope is that the government would realize that unregistered ECD sites can be just as important, and they actually need the support, be it funding support or infrastructural support, and that they play a major role in the poorest of the poor communities in South Africa.
There's only so much you can do with 36 million rand, but the point is what you can do with the ideas and the mechanisms and the approach that we've shown can work. And that is that you can reach thousands and thousands of children by using an approach that works with local NGOs. And government really holds the power to do that at scale and to multiply the impacts of what we've been able to show in this project.
I'd like to invite Zahira Mohammed to speak to us about why this initiative, what Ilifa hoped to achieve, and also to tell us about some of the partnerships that made this ambitious initiative possible. Over to you, Zahira.
Okay, great. Thanks for joining us today. I mean, we're certainly very excited to be able to share the COVID findings of the project with all of you who joined us today. And I mean, as Nicole said, we were dealing with a global pandemic, and those of us in Ilifa, as well as all of you on this call, were fraught with the crisis that the ECD sector specifically was facing, and the urgent need to be able to respond. So I think this project really came from a point of needing to address issues around the humanitarian crisis, around children who were suffering with severe food insecurity due to the global pandemic, ECD sites that were suffering from closure due to lack of income. But also, I think for us, what was also critically important was to say the ECD sector is a sector that's always in some point of time in some form of crisis, and what the global pandemic did was just unearth and just worsen a situation that already existed. So I think for us, what was critically important through this project was to show that while we're responding at a point of a humanitarian crisis, the types of interventions and programs and initiatives and learnings from this process have long-term impact. We quite keen and eager to demonstrate how issues of food insecurity for children is something that was always there. And through this, what we've learned through the pandemic and through the project is to share, to be able some long-term lessons on how ECD can be a useful focal point for dealing with issues of nutrition for children on a long-term basis. And also critically important was the role of our partners. I think what we also wanted to showcase was to show how a sector can work together, can collaborate, and with our partners like Smart Start, VPUU, and we were able to, and Unlimited Child, we were able to work collaboratively to show how a sector can get together and the role that our network and NGO partners can play in both, again, dealing with and responding to a humanitarian crisis, but also start building the blocks for long-term sustainability and long-term support to the sector. Thanks.
Thanks, Eria. Thanks for sharing your perspective and your insights on how important it is to act now while at the same time thinking about the future and, as you say, building those critical blocks to enable long-term systemic success. I'd now like to invite David, the CEO of the Douglas Murray Trust, to share his slides and his views with us and how this fits into the bigger picture.
Thanks, Nicole, and thank you for inviting me. And also good morning to everybody who's joined this really important and very encouraging webinar. I'd just like to start with a couple of slides. I was quite delighted to find this little quote from a book about the Midwest in the United States. The book's not that important to the story, but I thought that the insight is, and Natalie Capel, writing in Calamity's Wake, says, there are points where time accordions. It's if the past, the present, and the future are pressed together in a concertina, every minute toughing, and then every minute opening to be viewed. And, you know, it really struck me as we entered the calamity of COVID, that this is what was happening, that it was a time where so much was happening fast, where space opened up to engage in different ways, but where there was a sense of immediacy, a sense of urgency, a sense of being able to make things happen fast. And it resonated with the thinking of John Kingdon, and those of you who know the sort of public policy bent of the D.G. Murray Trust and the work that we've done, know how important John Kingdon is to our thinking, and that is really that policy windows are rare, they're infrequent, and they only open up occasionally. And according to Kingdon, they open up where three different domains come together. The first is where there is a clear identification, a clarification of the problem, distilling it in a way that makes sense, distilling it in a way that makes it practical and on the ground. The second is where policy options are put on the table, where in response to those problems, it is clear what can be done to respond to them. And thirdly, then the politics has to line up. There has to be a political appetite that has to come through a sense from the politicians that this is an issue that is concern, that ultimately it will be an electoral issue for their constituencies. And when those three pieces come together, the window opens up and there's the opportunity to make things happen fast. And you'll remember this photograph and just the incredible effect of that shutdown, of that moment of extreme crisis, where all of these people are lining up, not to vote, even though it's certainly resonant of the 27th of April, 1994, but to find food. And it was these factors and this immediate crisis that resulted in the accordion of time that resulted in an incredible pressure, but also then created the scope to make things happen. And as you all know, I mean, over the last 10 to 12 to 14 years now, a group of funders have been trying to address some of the major intractable challenges that are preventing South Africa from moving forward. Our starting point being that unless we start at the source of the human capital pipeline, unless we really address the issues of our children, there's no way that we're going to develop a sophisticated pipeline of human development that will drive social well-being and economic productivity. That's been our approach, and it's been a slow slog of trying to bring together exactly these factors, trying to ensure that we build political momentum, that we build public demand, that we incrementally show the evidence of what can be done. And often it's discouraging because things don't necessarily start to happen. But in a moment of crisis, things can. And the three key areas that we have sought to inform, and the policy windows that we've sought to open up again, as Zahira has said, firstly relate to nutrition in South Africa. And nutrition is the absolute core for economic growth and for the development of human potential. And the challenges that we have is that with 1 in 4 of our children chronically undernourished, stunted, yet that happening in an environment where there's a lot of food in this country, where the highest stunting rates are, for example, in a province like Gauteng, which has so much wealth and so much food. But the problem is that the food value chain for children is not there. Children in informal settlements, in inner city areas, simply do not have access to high value food. So has been a first real obsession of ours is how do we address not only the absolute lack of food, but in South Africa the type of food that's provided, ensuring that it's highly nutritious and ensuring that there are supply chains and value chains in place that help children. That's the first. The second is, as Zahira said, whether our children have got access to early learning. And the constraint that we've had is that with most of our children in childcare, in informal settlements, not being able to access subsidies, not being able to access grants, and yet knowing that unless we can incrementally start to engage with the informal sector, unless we can start to put in place a process of quality development within that sector, we're not going to get out of the hole that we find ourselves in as well. And the problem being that the state has no way of interacting with the informal economics sector. So our imperative being to try and create a way in which there can be an interface, where there can be a structured way in which the state can start to support and encourage the economic sector, and particularly in this case, early childhood development. And then the third element obviously has been, how does the state and how do we as a country respond to crises? And we know that our social relief of distress is very inadequate, that the money that is spent inefficiently, that for every 700 Rand food parcel that's put out, there's a premium of 60% on top of that for the distribution costs. And so if we can find a way to take away that logistic cost, take away that distribution cost, we will be able to make the money go further, even as we try and advocate for greater amounts of money. So the convergence of nutrition, of early learning, of social relief of distress, in a moment of crisis, in a moment of deep horror in a way for our country, as all of a sudden our children were excluded from food, from any sort of social relief of distress, and from early learning, actually provided us with an opportunity to show what could be done. and to show how the policy window that did open at that time could be effectively seized. And that's what this project was about.
Thank you so very much, David. I'd now like to hand over to the Ilifa team, and I believe we'll start with Andrew to get into the details of what was done and what was learned.
Thank you very much, Nicole. So the project had several activities that we focused on. First and foremost, we were really looking to get the ECD sites compliant with the protocols that the government put in place for reopening, and so that they could comply with those health and safety regulations and reopen. Of course, this was out of reach for most, especially unregistered ECD sites. So we provided a safety pack for them, which you'll see down at the bottom of the slide. We provided equipment for them, a comprehensive pack to allow them to comply, so that they could do so. But as David mentioned, food security was also one of the key pillars of this project. So through digital food vouchers, which were sent through the Flash system with a network of hundreds of thousands of spaza shops throughout the townships, we delivered digital food vouchers to thousands of ECD sites. There were about 1,700 of them in our network, which the partners, VPUU, Smart Start, and the Unlimited Child put together. And then the third element was the income security. As you will know, the huge risk to the sector was that the ECD staff weren't being paid for months because parents stopped paying fees. Especially at these unsupported ECD sites, staff started attritioning. And so our goal was to provide a digital food voucher to these staff to try and support them through this period and keep them engaged in the ECD sector and working for their ECD programs. Another key aspect was water support. Now, COVID or no COVID, access to clean water is a major challenge for ECD sites, especially those in informal settlements and those in isolated rural areas. So we did an assessment of the needs across the whole cohort of sites we were supporting, and we provided water support to sites that needed it. And of course, as David has alluded to, that policy window was something that was always front of mind for us, and learning and advocacy from this project was a key part of our intention. It wasn't just so that we could respond to a humanitarian crisis, but the idea was, what could we learn from the crisis which could help us to really show the needs of the sector and how to address them. So we really wanted to test ECD sites as nodes of nutrition support. We wanted to test and prove the role that NGOs with large networks of ECD sites can play, and also the potential of this digital voucher system, which, as has been said already, cuts out the middlemen really and allows food to go directly to children without those extra costs. We can move to the next slide. So as part of this idea that the whole project was a part of learning, or was really trying to learn and advocate, we instituted some pretty rigorous monitoring and evaluation activities. It was a key aspect to really help that we could learn from the project and also share lessons so that the sector could be strengthened. So we developed very rigorous monitoring tools for ECD sites to use so that they could record child attendance and feeding data. We also, through our 3 partners, conducted 3 site visits, at which assessment surveys, compliance surveys, and staff surveys were conducted. And of course, the sites were also helped by the field workers, given various pieces of advice and support. And also we conducted quite a number of tracking activities on voucher redemption and use, so that we could monitor what kinds of foods were being bought, how useful the co-care voucher system through cell phones, through SMS were, and what lessons we could take from that. We can go to the next slide. So through these activities, we were able to rise to an extraordinary challenge. So for example, we managed to feed more than 30,000 children regularly throughout a 4.5-month period of severe lockdowns and food shortages. We also provided the staff vouchers monthly to 3,473 staff who were given 250 Rand vouchers over that period. We provided water support to 284 of the most vulnerable sites for whom it was identified that they needed such support. So things like JoJo tanks and other water storage facilities were provided to them. And as I mentioned, we provided the COVID safety packs. Smart Start had already provided packs prior to our project commencing. So we provided 731 full packs to the rest of the sites within our project, which helped them to reopen. And then in January, February this year, we again provided a top up to all the sites in the 3 partners networks so that we could ensure that no matter how many lockdowns and how long the COVID crisis stretched for, we would at least have them covered in terms of compliance and they could remain open. And then, of course, we provided to all of our sites information on how to supply and source nutritious foods, the COVID-19 reopening protocols, and also we linked staff and programs to alternative support, such as the Vangasali and also the ECD Economic Stimulus Relief Fund. We did this throughout our project. And through these activities, we believe, we've documented in quite a lot of detail, which you are welcome to read, how the project really supported these sites to bounce back from a situation where most of them were closed by August, September, and there was a huge risk that the ECD sector would collapse, to the fact that because of our support, 62% of these sites, which had been closed a few months before, were now reopened by November 2020, were able to comply with the regulations. And by March 2021, our tracking data showed that almost all of them had reopened. We also found that the staff vouchers were really fundamental in helping staff to be retained. 78% of the sites that we surveyed said that the staff vouchers had really helped their staff to remain committed, remain loyal, and also to crucially have some kind of hope that the situation wasn't hopeless and that they had to leave the sector. In 2020, by the end of 2020, we found that most of the sites had around half of their children attending. But when we resurveyed in 2021, attendance had almost returned to normal after the January or the Christmas holidays. So that was a very encouraging sign too, showing that with the right support, children were returning, parents had the confidence, and so on. We also found that in 2020, parents were widely unable to pay fees. And in fact, hardly any of the sites are receiving fees, which also emphasized how important our support was. But by March 2021, an encouraging 27% of the sites were receiving most of the fees, again from parents. 40% of the sites said they received at least some, and only 33% said that they didn't receive very much so far. So it was highly encouraging. And between all of these different outcomes, we also found that, you know, the combination of child feeding, good safety, and so on enhanced the relationship between these sites, the parents and their communities. So in a sense, these ECD sites were able to become the center of community during this crisis due to the support. We had a number of implementation challenges, which I won't go into, but we also identified a few systemic challenges for the sector in general, which I'll just briefly touch on. One of them was managing data in an informal sector. As we know, the ECD sector is largely informal, and what we found is that ECD site selection and verification is a big challenge. NGOs which work with ECD sites have to really spend time keeping updated databases to make sure that they have the most up-to-date site information, and also gathering accurate beneficiary data. If you want to do a cell phone-based voucher system, you need correct names, correct staff details, and also correct cell phone numbers. So that's also a challenge we identified. And although we managed to get around it in the majority of cases, it was something that caused a few issues, and I think in future endeavors will have to be streamlined. And then, of course, tracking attendance and feeding data is also challenging, especially where you have very isolated rural sites, which are not easy to get around quickly. But there are electronic means of tracking this data, and I think our program showed that there are some new innovations which can work. The second big challenge was we were working with a very young co-care voucher system. This was the system in which cell phone vouchers through the spaza shops, and this was developed really for social relief of distress, and was very much to go off every required different vouchers depending on how many children they had. So we had vouchers ranging from 250 Rand every 2 weeks to 8,400 Rand for the bigger sites. And the co-care voucher system was put under considerable pressure. For the most part it worked, but I think there were significant lessons around developing voucher systems and how the complexity when you have ECD feeding actually needs to be taken into account. And there were also some issues around security, which we learned some lessons, which I think if you want to do this kind of approach for ECD feeding and funding to ECD sites, it needs to be fairly robust, and you need to make sure all of those areas are covered. So I think with that, I'll hand over to my colleagues to carry on with the other lessons that we learned.
Good morning, everyone. In this segment of the presentation, we're going to share the lessons that we learned from implementing this project. And we will share some of the key recommendations that really come up for us that can really support the ECD sector. Our lessons and recommendations are actually clustered around 3 themes, which are payment systems, nutrition, and the crucial role of NGOs. So I will start off by speaking on the lessons and recommendations around the payment systems. So the digital vouchers were the provision of digital vouchers were a core component of our project. We really wanted to test the potential of a digital voucher supporting the feeding of children in ECD sites, as well as the provision of income support to ECD staff. And what we did is we tracked the amount of vouchers that we issued, and also tracked the redemption rates of the vouchers. And we found that we issued a total of over 15 vouchers and 13,380 staff vouchers, which supported about 3,500 ECD staff members. And our redemption rates were quite high and averaged at 86% for the site vouchers and 89% for staff vouchers. This really showed that digital vouchers can be a vital for the ECD sector to receive and to redeem these vouchers. We conducted a compliance assessment after a few of the first few voucher runs. And here we wanted to explore the perspectives of our beneficiaries, whether the voucher system was usable and how they experienced it. And a majority of the voucher beneficiaries reflected that they had a very good experience without any problems. Only 1% of participants, of beneficiaries, reported that they couldn't redeem their vouchers, and a slow amount of 6% of beneficiaries say that they experienced some significant redeeming, but they were still able to redeem. So what we found is that payment systems, they need to take account of the context. Payment systems need to take into account the context of where the vouchers are being issued. So factors such as the rurality or the urbanity of the area determine whether a voucher is going to be redeemed or not redeemed. One of the key lessons that we found is that innovative payment systems, including electronic vouchers that are linked to local spaza shops, can work to channel government and the private sector support for nutrition. A key recommendation that we found is, a key lesson that we found is that we need to have we need to be able to have accurate collection of beneficiary data around the ECD practitioners, the sites, the number of children, around even the contact numbers. Without a reliable and updated, accurate cell phone numbers, you are not able to use a digital payment system. So what we learned is that you need to have strong, flexible systems to be able to gather and store and make available data. Delivery vouchers, digital vouchers need to be highly functional and user-friendly. They need to be dynamic and to be able to cope with a varied amount of requests. We found that if the digital voucher system is not friendly, you would require a lot of support on the ground to be able to support beneficiaries. And in the beginning, we found that in our project, our implementing partners had to provide a lot of support to beneficiaries in terms when they struggled to be able to redeem vouchers. So the key lesson here is that digital vouchers need to be user-friendly in order to reduce the amount of support that is provided on the ground. Voucher pins, around the strict system security and control that Andrew mentioned earlier, we found that voucher pins need to be secure and they need to be only accessible to the beneficiary who is going to, who is supposed to actually receive the voucher. So if the pins are not secure, there is a possibility of an unintended person to be able to access this. So right from the beginning in developing a delivery voucher system, you need to have full security considerations when developing this voucher system. And even ongoing, you need to have in place an automated monitoring of risk an ongoing monitoring of risk to ensure that the operator of the system is able to constantly be ensuring that there isn't any breach in terms of accessing the delivery vouchers, the digital vouchers. What we also learned in the project is that the provision of store location of information is really important because it greatly assists ECD sites to be able to identify the best options for redeeming their vouchers. So in addition to the SMS digital voucher, we recommend that there are alternative payment options such as fintech tools and mobile e-wallets that can be explored for ECD feeding. Through this project, we were able to demonstrate that innovative payment systems, they can be effective in channeling government and private sector support for ECD programs. The government and private sector need to explore the potential that is there in using digital voucher system as a funding mechanism for the ECD sector. And what's important that we learned in this project is that NGOs have a crucial and an important role in supporting and mitigating some of the risks and challenges that can be experienced in implementing an innovative funding system such as a digital voucher in the ECD sector. I will hand over to my colleague to share some of the other lessons around nutrition and NGOs.
Thanks, Tammy. I'm just waiting for my slides to move. Here we go. All right. So one of the things we were interested in exploring in the project was whether if we provided unconditional funding, so our digital voucher was provided without conditions on what it was allowed to be, what food items it was allowed to be used for. And we wanted to know whether with a little guidance and not being conditional about what the voucher could be spent on, whether ECD providers would choose nutritious foods for children and provide them in the ECD sites. And we were really encouraged by our findings. We gave some guidance on recommended best buys. So we gave a list of 10 items that were recommended, high protein food items that were recommended for purchase at spaza shops to be provided in the ECD sites. And our tracking of what was fed at ECD sites and what was purchased through the vouchers showed that there was close alignment between what we recommended and what was provided in ECD sites. So we had some of the most common foods that were purchased were pilchards and mealie meal, rice and full cream milk, and even vegetables. And we weren't sure whether there would be whether there would be a lot of vegetables available at spaza shops. So there were really some encouraging findings in our tracking of what was provided. So our data showed that our guidance was largely followed, and this was really encouraging. There were, of course, also some less healthy food items that were purchased and provided in ECD sites, so sugary snacks, for example. And that did show us that there is definitely a need for more understanding of what is being provided in sites, particularly where there isn't guidance, and that there's a need for more education and lobbying around what is a nutritious meal for children and what should be provided at ECD sites. But what we were really excited about was that through the project, we were able to show that unregistered sites can provide nutritious food to children and serve as nutrition hubs. And this showed a need for more research into what kind of foods are provided at ECD sites, but that NGOs can play a role in the monitoring and gathering of data and supporting ECD sites to provide nutritious food to children. Particularly, this leads us to assert that government should see unregistered ECD sites as a place where they can support the provision of nutritious food to children, irrespective of their registration status. And so our recommendation is that government should be investing in nutrition programs for young children through all ECD sites to mitigate malnutrition and support early learning outcomes. Another key thing we found in our monitoring and evaluation tools was that the provision of meals at ECD sites was one of the key drivers for parents to send their children back to ECD sites after they reopened. And so we think specifically that funding to support nutrition should be a separate funding stream that's de-linked from registration and provided to ECD programs irrespective of their registration status. We tested quite a specific mechanism through the project for how support can reach ECD sites. One of the key characteristics of the ECD sector is that it's made up of many quite small entities that because there's such a high rate of or so many unregistered sites in the sector, the ECD sites themselves are quite informal, and that's quite a daunting prospect for government to imagine how it can support and regulate this large and informal sector. So our project tried to test a concept of working through local NGOs with networks of ECD sites to provide support and to gather information and to regulate or to track what's happening in the ECD sector at a site level. So I think we were able to demonstrate that NGOs can play this key intermediary role by channeling support where it's needed, by identifying bona fide beneficiaries, bona fide ECD sites and vulnerable children, and doing what's needed to provide the assurance that that support is going to the right places, and to provide government with information to better inform the type of support that's provided and the need for support and the nature of what's happening on the ground. So we believe that the role of NGOs is crucial in supporting sites to meet government standards, to offer quality learning and provide nutrition to children. And this mechanism that we tested allows the leveraging of NGOs' relationships and networks with ECD sites, and their role, and can use those relationships and networks to identify and validate information on the ECD sector, on the sites, staff and children that make it up. It can also leverage local capacity and support compliance and monitoring and ensure delivery. Just in this project specifically, NGO partners that we worked with who hadn't played this type of role previously enhanced their capacity and experience with a range of support measures through this project. So our recommendation here is that government should work with ECD NGOs to reach and support unregistered sites, that this is a way to overcome the daunting task of reaching the large numbers of unregistered sites with support, and of getting a clearer picture of what's happening in the ECD sector and what's really needed to support the sector to thrive, by using NGOs to provide that information and to help to regulate and make sure that the support that's provided is being done in the way that's intended. That's it from us. Back to you, Nicole.
Thank you so much. Thank you, Zara, Tembi. Quite soon. So I want to ask, there are some questions in the chat. I'd like to ask if there are any specific questions for David before he has to leave us in about 10 minutes time. So please feel free either to pop that in the Q&A, which I'm monitoring, or in the chat. While you're doing that, I think I will call out some of the questions. Sorry to the participants that we can't have your voice, but I will do my best to bring your questions across, hopefully in a way that is respectful of what you've asked. So our very first question is with regards to the slide that spoke about bouncing back. Ilifa, do you have any comparative data for the unsupported sites? So I'm assuming these are the sites that weren't part of this particular project. So curious to know if there is any available data. I'm not sure who wants to take that. Andrew, go ahead.
Yes, so we didn't specifically have a control sample because it was just too complex to run it like a sort of random control trial, as well as trying to do everything else. However, I think there was a second question posed there from Kimberly, which illustrates the point that without full support, many ECD sites were really just unable to get to comply with the protocols. The protocols were extremely stringent. They required a lot of resources and a lot of different materials, not only sort of guidance and moral support, but also just the purchasing of these support packs could be 2,000 or 3,000 rands, which for most informal. So no, we didn't specifically, but we have a lot of anecdotal evidence from within the networks of our partners, of those who weren't part of the project, but also from others who have contacted us to say that for sites that weren't supported, there was a lot. It wasn't impossible, and I think many of them were struggling and trying to reopen by December, January, February. But certainly I would suspect our numbers are higher than an unsupported site for sure.
Thank you very much for your response, Andrew. I'm going to ask Zahira to respond to some questions that Pam has posed, particularly around now that we know that the function shift is moving from DSD to DBE, should we be pushing for the National Schools Nutrition Program to be extended to all ECD programs? What are your views on that?
Sure, and I think that's a great and very obvious question that's front and center of so many people's minds. I think what we need to understand is that we need to make sure we design a system that ensures nutrition gets to ECD sites. And whether the school nutrition program is the automatic solution is something we still need to explore, because the machinery that governs the school nutrition program, which is targeted your public schooling system, we're not quite sure if it's geared up to be able to make sure that that nutrition gets to the informal small providers, which is quite differently set up to how our public schooling system is set up. So our conversations rather is to say, let's look at the variety of learnings and options that we have on the table and figure out what's the right mechanisms we have that allows us to make sure that PBE gets school nutrition to children, whether it's the NSNP or a different type of mechanism.
Thank you so much, Zahira. There's some questions coming through about the specifics about how the digital voucher payment system works. Am I correct in saying that that can be shared via email afterwards, or perhaps something anyone would like to comment on now?
I'm happy to take that question quickly now, Nicole, but just to say that there are some specific pieces of write-up of the project that are available on our website, which we'll share the links to during the course of the last 10 minutes of this webinar and via email with all of you later, which go into some detail about how this works. But just briefly to give a quick rundown. So the ECD NGO partners helped to identify the beneficiaries on the ground. And they compiled lists then of those beneficiaries, names and cell phone numbers and other information about them that we needed. Those were then sent to Flash, which is a digital payments services company, and they issued the beneficiaries with the amount that they were assigned based on work that we'd done. So we had the two types of vouchers. We had an ECD site voucher, which was sent to the ECD manager or a designated ECD staff member. The value of that voucher was determined based on the number of children that had been enrolled pre-COVID at that site. Then that voucher was sent to the individual's phone. It gave a unique PIN, which the individual would take to a spaza shop, any spaza shop that was on the Flash network. I don't know if you've seen, some of you, the little green cow that says Flash at some local shops around, and spaza shops in general. They can then take that PIN voucher to the spot and redeem the voucher for goods to the bank. They received another PIN and could use the difference either at another store on another day. So that's how the digital voucher system worked in summary, but as I say, more details available in our writing.
Thanks so much, Laura. I suspect that you might want to take these next questions as well. Let me just read them out. How many sites were involved and how were they selected? So what was the selection criteria? And then following on from our same question there, no, that's not the right question, were there any recommended or allowed products that could be purchased through the voucher? So did you try and sort of drive purchasing patterns in any particular way?
Start with the second question. So we particularly didn't want to ring fence certain items to be purchased through the voucher. We wanted to see whether if we gave just some guidance and made clear the intention of the voucher and what it was to be used for, whether that would give enough shape to encourage people to use the voucher for food, for nutritious food for children. So we did give guidance. We firstly, we provided the 10 recommended best buys that I showed in one of my slides. And we also gave additional information that was compiled by the Department of Health around ECD feeding, so nutritious meals to meal plan guidance and so on, that is provided by the government. And we encouraged our ECD partner, our NGO partners, to share that with sites. And I think some of them even gave some training to sites and had conversations with sites about what kinds of goods we felt should be provided to children and therefore bought with the vouchers. On the question about how many sites and how they were selected, so we had 1,700 sites that were part of this project. We first started by selecting NGO partners to work with. So our implementing partners, Smart Start, the Unlimited Child and Violence Prevention through Urban Upgrading. We wanted a small number of partners that we could manage working with, who worked in all different provinces. So between our three implementing partners, we had representation across the country. We wanted to get a good diversity of different types of areas and different local conditions. And then we were clear with those partners that we wanted to work with unregistered sites, because we were sure that they were the most likely to be excluded from any kind of support that would be offered by the government. And so those were our criteria. And then we put it to those partners, those NGO partners, to select the sites that they felt would be most vulnerable within that range of criteria. So the idea was really to reach the most vulnerable in a humanitarian moment, but also to think about the longer term potential systemic mechanisms that we could demonstrate through the project.
Thanks so much, Laura. And what I'm hearing from you is that this is very much the start of a conversation. You've gathered evidence, but you've also acted because you needed to act quickly. But this certainly isn't the end. So thank you for responses. Zahira, I'm going to ask you to take this question. There's agreement from Pam that absolutely NGOs play a critical role in reaching young children and communities. And in fact, Pam, in preparing for this webinar, it was something that came up very often. It was emphasized, so absolutely. And Pam says, surely we should be supporting Nectar as the organization with the largest ECD NPO national footprint to advocate to government to use this ECD NGO network to address this nutrition crisis. So there's an opportunity there to really work with Nectar. A response to that, perhaps, Sarah?
Sure. So I think so yes, obviously, definitely. I mean, we're finding that the role of the NGO partners is very much a bridging role. So beyond just nutrition, we see the potential in using our NGO network, supporting our NGO network as a key nexus point between the state and our providers. Because as David mentioned as well, I mean, most of our ECD providers operate in a very informal basis. Very few of them most of them are unregistered. They serve the working in poor communities, don't have bank accounts. So for them to connect with the state system, whether to get registered to access nutrition or to access funding, it's incredibly difficult. And a lot of our NGO network partners provide that kind of supportive role. And one of the key things we'd like to do going forward through this process is think, how do we formalize those arrangements? How do we actually support the ingenuity and the creativity and the work that our NGO partners do to help the ECD sites directly? And how do we able to make sure that government recognizes them as a key contributor to supporting the ECD sites? And how does government support them? Because I think what we need to move away from is quite often we're expecting our NGO partners to do this for the sake of it, because you're an NGO, you must support, you must help. We need to shift away from that and recognize the key critical contribution they play in this role, and support them to play the role and make them part of and recognize the role they play in within the system. So it's definitely one of the systemic solutions that we would like to do more work on and take forward to develop more tangible recommendations around how it can work in practice.
Thank you very much, Sarah. And then just on the topic of systemic solutions, just a question about whether there were any linkages established with local municipalities or the Department of Water and Sanitation to come up with sustainable solutions about regarding the lack of water. So it's something that they can look into going forward.
So maybe I'll take that question. So we were organizations that had experience working with local municipalities, and that was Lima as well as Impande. They did not directly work with local municipalities in this project. However, one of our partners, VPUU, attempted to work with the local municipality in Gabon, and this was a lengthy and quite involving process to get the local municipality to be able to support to connect water for one of the ECD sites. So we were only able to demonstrate it at one ECD site.
Thank you very much, Thembi. I'm going to just take a final question, and the question is, what happens in areas where there aren't any NGOs or NPOs operating? Could these recommendations still actually work and come to fruition? Not a hard question at all for the last question. Just throwing it in there.
I think it's a really important thing to consider, and I think in the way that we design and kind of promote the mechanism that we're thinking about here has to take out that we're promoting kind of the only way of working, that working through ECD NGOs is the only way, and there have to be other ways too. But yeah, really appreciate the reminder, and I think part of it is about providing touch points that ECD sites could connect to themselves. So not limiting it to the existing networks, but to try and broaden those networks too.
Thank you very much, Laura. And just finally, there was a question from Lashiwe about how to connect more closely with Ilifa, and I'm going to ask the Ilifa team to please follow up after this call. In the 1 minute we have remaining, Zahira, let's talk about what next.
Well, what next is that we are determined to move forward with some of these recommendations, have lots of conversations with many of you on this call. We've got some good ideas and thoughts about how we can take it forward. Really having certain conversations with DBE around, I think for me, the critical one we're really eager to move forward on is the role that ECD sites play around as nutritional hubs for children, and how it's critical that it's delinked from all the other compliance requirements, and then the role of our NGO partners, and to be able to make sure how their role is acknowledged and recognized and systematized. So those are about at least two immediate things that we're already currently working on as the Ilifa team. But I suppose just to close, to say just thank you. This has been an amazing project that would not have been possible without the support of our core funders, as well as the core partners. Without their involvement, taking this on at a time when they themselves were dealing with crises and sustainability issues, I think it's absolutely phenomenal. And just from an Ilifa side, it's the first time we've taken on a project like this. So just a big thank you to my core Ilifa team for their tenacity to actually make this a success, and all of you for just taking the time to come to listen to our learnings, use our resources, engage our team, and we'd love to hear more of you from what you think about this or any other information you'd like to have. Thanks.
Great, thank you so much. And I'm sure if we could hear applause from the attendees, we would, because we've had lots of compliments coming through in the chat. Just to echo what Sarah said, thank you so much for making the time. We're tired, it's the end of the year, the end of 2 years, long years. So have a wonderful and a safe festive season. Thanks so much for joining.